A case history told in the journal Nursing from May 2012 includes a case study about TJ. TJ's a young 43-year-old who went into an outpatient surgery center for a minor abdominal surgery. During the induction of his general anesthesia, he developed generalized muscle rigidity, cardiac arrhythmias, and an elevated temperature. It was decided that he was having a malignant hyperthermia crisis. This is a reaction caused by a rare skeletal muscle genetic disorder. He was treated for the MH crisis and moved to an acute care hospital where he later died. His family was shocked. How could this happen? It was just a minor surgery. As they spoke to each other, they remembered another incident in their family that had happened a couple of months earlier. A nephew of theirs had a minor surgery at the hospital. He developed jaw muscle rigidity, a very elevated temperature, and had to go to the ICU. He was later released and survived. If the anesthesia provider had asked TJ about his family history, he may have related this story, and the anesthesia provider would have recognized that he was an MH susceptible individual, and then he would have been treated with non-triggering medications, thus avoiding this tragic death. We all want to be safe during surgery. That's a great fear. When people wake up from anesthesia, I have noticed as a nurse that many people relate the fear that they would never wake up from anesthesia. To protect your safety during surgery, understand what MH is and know a few things that you can do to protect yourself during surgery. As a nurse who is certified in post-anesthesia care, it is my responsibility to protect your safety during surgery, to protect you from MH if you have a crisis, and to know how to treat it if one occurs. Today, I want to tell you what MH is and how to protect your safety during surgery. First, let's learn what MH is. And I'll share with you some questions that you could ask your anesthesia provider in order to protect your safety. What is MH and what can it do to you? Well, according to the AORN Journal of May 2013, malignant hypothermia is a rare inherited disorder of the skeletal muscles. It can cause death if not treated. What happens to you when an MH crisis hits? Well, in a susceptible individual, and certain anesthetic agents are given during surgery, the genetic problem in your body causes your muscles to contract continuously. This muscle contraction leads to a rise in temperature, cell death. This cell death from the damaged skeletal muscles releases a lot of toxins into your body, and this causes cardiac symptoms, irregularities, arrest, and even death. This is called an MH crisis. According to the International Student Journal of Nurse Anesthetists, Volume 10, Issue Number 2, malignant hypothermia crisis is 70% fatal if not treated. So this is very serious. Nobody wants that. The only treatment available is dantrolene. This drug must be reconstituted and administered to you through your IV very quickly when a malignant hypothermia crisis is recognized. Other things that need to be done for you are cooling. The staff will cool you by all means available. And all symptoms that I spoke about earlier, life-threatening symptoms need to be treated, such as the cardiac arrhythmias, in order to prevent cardiac arrest and death. Now that we know what MH is, let's look at a few things that you can do to protect yourself. Preoperatively, make sure that your anesthesia provider asks about your family history in regards to their reactions to anesthesia. He should ask whether your family members have had any reaction that included unexpected death during or after surgery, unexpected muscle rigidity during or after surgery, or an acute rise in temperature. If there is a history of this, the surgeon and the anesthesia provider will be notified, and they can use non-triggering medications to give you your general anesthesia, thus avoiding an MH crisis. Another question that you should ask is, does the facility have dantrolene on hand in order to treat the MH crisis? Because sometimes an MH crisis can occur even when there is no family history of malignant hypothermia. Protect yourself and prevent a tragedy. Know about MH and know what you can do to protect yourself. Let's review. MH is an inherited skeletal muscle disorder that can cause a malignant hypothermia crisis if certain agents are used to induce your general anesthesia. Make sure you ask your anesthesia provider if there is dantrolene on hand, and make sure he asks you about your family history in regards to their reactions to anesthesia. Then, if you are a susceptible individual, non-triggering medications can be used for you, and you won't experience this tragic happening. Protect your safety during surgery. You should understand what MH is and what things you can do to protect yourself. Unlike TJ in the case study we spoke about earlier, you can ask questions of your anesthesia provider. You can make sure he asks you specific questions, and you can prevent a tragic death in your own surgery.